This video explains the main steps to connecting an indwelling pleural catheter, also known as a pleurX, to a continuous drainage collection system like the pleurevac. The detailed protocol of the procedure is available on the MUHC intranet in the Policies and Procedures section. Search in the alphabetical section Drains. Always use pleurX material, devices, and access kit to connect to the catheter. Otherwise, damage to the one-way valve can occur and cause complications such as a pneumothorax, infection, or malfunction of the catheter requiring its replacement. You will need the following: a drainage collection system like a pleurevac, one pleurX lockable drainage line kit, one three-way connector, one needle-free connector, one minor dressing tray with scissors, sterile normal saline to clean insertion site, 2 pairs of sterile gloves, 2 alcohol 70% and chlorhexidine 2% swab sticks, 5 alcohol 70% and chlorhexidine 2% swabs, 1-inch pink tape or equivalent, 1 cath secure or 1-inch clear tape. The pleurX lockable drainage line kit includes the following items: 1 blue sterile field from the wrapping, 3 sterile alcohol swabs, 1 pair of sterile gloves, 1 pleurX lockable drainage line with a white roller clamp, 1 5-in-1 adapter, 1 pleurX valve cap, 1 blue emergency slide clamp, 1 pre-cut foam pad, 4 sterile compresses of 4x4, and 1 semi-permeable transparent dressing. Before connecting the pleurX to a continuous drainage system, wash your hands, wear appropriate PPE if the patient is in isolation, identify your patient by using double identifiers, explain the procedure to the patient, take vital signs, assess the patient's pain, ensure privacy, close the door or pull the curtain, position the patient comfortably, clean work surface. Open sterile supplies onto sterile field. Chest tube drainage collection system, your pleurevac. The minor dressing tray with scissors. pleurX lockable drainage line kit. 3-way connector. Needle-free connector. Don non-sterile gloves. Partially open the alcohol 70% and chlorhexidine 2% swab stick and place it on the side of the table. Remove the old dressing and examine the site. Check the catheter, check the insertion site, and notice if any sutures are present. Sutures are usually removed after 2 weeks. The polyester cuff should not be visible at the surface of the skin. If the skin is visibly soiled, use normal saline and supplies from your dressing tray to clean the skin. Allow the skin to dry completely or pat dry with sterile gauzes. Take a chlorhexidine swab in each hand and clean the catheter from the skin towards the cap, only touching the catheter with the swabs and not your gloves. When you reach the cap, remove the old cap and scrub the valve for 15 seconds. Make sure once you have cleaned the catheter, you don't touch it again with your gloves. Keep holding the catheter with a chlorhexidine swab using your non-dominant hand. Take the alcohol 70% and chlorhexidine 2% swab stick and clean the skin for 15 seconds in one direction with vigorous friction, and clean for 15 seconds in the other direction. You should clean an area larger than the size of the dressing. Be careful not to pull the catheter. Do not remove any scabs. Gently bring the sterile field close, holding the edges, and drop the catheter onto the sterile field. Place the disinfected catheter down on the sterile field. Allow disinfectant to dry completely. Alcohol 70% and chlorhexidine 2% takes at least 2 to 5 minutes to dry completely. Do not blow or wave your hand to speed up the drying process. Remove your gloves. Perform hand hygiene. And don your sterile gloves. Prepare the chest tube drainage collection system, the pleurevac. Twist the blue stand from under the drainage system and place it perpendicular to the drainage system. And position the system upright while maintaining sterility of the end of the tubing. Take the pre-filled bottle from behind the drainage system unit and fill the water seal chamber with the water to the 2 centimeter line, using the same port that you would connect your suction to. If the system is to be on wall suction, ensure the suction dial is at the level ordered by the physician. Prepare the connection of the drainage collection system. Keep all tubing and drainage collection systems sterile. Using sterile scissors from the dressing kit to cut the distal part of the drainage collection system tubing to remove the two-way connector and tubing. The tubing needs to be cut to allow a tight seal with the 5-in-1 adapter. Prepare the pleurX lockable drainage line. Connect 3-way connector to the pleurX lockable drainage line, needle-free connector, 5-in-1 adapter. Slide the white roller clamp from the drainage line towards the end of the tubing, since some of the tubing will be covered by the dressing and you need to have access to the roller clamp. Position the 3-way connector with the off position towards the drainage line. The white roller clamp should be closed when accessing the catheter. Connect the collection system tubing to the white 5-in-1 adapter that is already connected to the drainage line using the 3-way connector. You can disinfect the valve once more using the sterile alcohol swab. Insert the drainage line access tip into the catheter through the one-way valve until a click is felt. Lock the drainage line into place by rotating the access tip until you hear a second click. This will secure the connection between the catheter and the drainage line. Place the pre-cut foam pad around the catheter insertion site. Wind the catheter and 1/3 of the drainage line into a spiral and place it over the foam pad. Do not make a knot or kink the catheter. This could damage the catheter. This will allow the catheter, including the valve, to be completely covered under the dressing. Cover with 2 4x4 sterile compresses. The catheter, valve, and drainage line should not be in direct contact with a transparent film dressing to prevent accidental dislodgement when removing the dressing. Apply sterile transparent film dressing. Use pink tape to secure the connection from the three-way connector to the drainage collection system. Open the three-way connector to allow drainage into the drainage collection system. Fully open the white roller clamp of the drainage line. Secure the tubing to the patient's chest using a cath secure or tape. This prevents tube dislodgement and decreases traction. Dispose of supplies and clean working area with disinfectant wipes and allow to dry. Remove gloves. Perform hand hygiene. Connect drainage collection system to suction if prescribed. Review the following education points with the patient. The drainage system should always be below the patient's chest level. Ensure that the drainage system remains upright on the floor. Ensure tubing does not have kinks or obstructions that may inhibit the drainage. For transport, ensure the drainage system is safely fixed to the bed, stretcher, or IV pole. If the system is on low wall suction, ensure with the medical team that it can be disconnected for ambulation. The following monitoring is required for all chest drains connected to a drainage collection system. Evaluation of the drain output using the FOCA acronym, and vital signs every 4 hours. Document vital signs in OASIS or MedUrge. FOCA evaluation can be done on the Pleural Drainage Documentation Form, DM2569, or on the input and output sheet in MedUrge. Tolerance to treatment or any side effects in the progress notes using the DARP recording method.